Hey everyone, welcome back to the Live Better, Feel Better podcast for AdventHealth. I'm Victoria Delco. It's so good to see you all back here and have you joining us as you are listening in as well. Today we are talking about something that touches every single one of our lives. Yep, our hearts. That's right. February is Heart Health Month, and it is a good time for us to maybe do a little bit of self-check here and ask a very important question. Am I taking good care of my heart? You know, the heart definitely needs some love from us on a regular basis. And there are so many things that we just, can do that make it part of our regular routine. But one of the things I want to talk a little bit about is let you know how fortunate we are here in Western North Carolina to be able to have access to exceptional cardiology and cardiac heart health. And it's right here in our backyard. You don't have to travel far from home. I'm talking about the cardiac or heart care that is available with AdventHealth. And what's super special about that heart care is that it comes to you in a very unique way. You see, it's at the very core of how we deliver all of our health care, from the heart with compassion. We call it whole person care, and we're caring for your body, mind, and spirit. Now, I could go on and on about all the things we need to talk about with our hearts, but you know what? I really want to go to the pro, the expert, the one and only, who can help us answer lots of questions, our good friend and our medical director of cardiology here at AdventHealth, Dr. Eduardo Balcells. Hello.
Hello. Thank you. That was pretty animated. That was great.
Well, I've had a couple cups of coffee. No, I'm just kidding. I actually did work out this morning, so I've got energy. My heart's working well.
That's good.
Yeah.
That's very good. That's actually one of the, I always ask patients, focus on what do you do? What's your day like? What's your week like? So that's good.
Well, I got this day started off pretty well. Not everyone starts off like that, but I try to get more than less. So you know what? I still every once in a while when I'm out and about, get people asking, about the types of services, care services we provide. And one that comes up quite often. I know it's important in my family. I have a history of heart health issues. My father had several of them. And even, in my immediate family, we are mindful of it. But heart care, and some people make some assumptions about it, but I'd love for you to tell me a little bit about what it is to have AdventHealth's cardiology program here right in our own, so close to us where we live and work.
So that's a good question. First of all, everyone needs to remember that it's not just the heart that we're talking about. Mm-hmm. Many people come into the hospital or to clinics with other ailments, and their heart's a part of it. So the heart's sort of integral to the body, and it's affected by other disease states. So cardiology is commonly called upon to help co-manage patients. So having a well-developed program within a hospital setting or a hospital system within a region is paramount to taking care of the whole person. So AdventHealth has, since I've been here 2 years, it's been almost 2 years, has really put an effort to grow the cardiovascular program. What does that mean? What does that mean for patients? That means not only that you'll be able to come and get the appropriate assessment by physicians, cardiovascular physicians, and the appropriate testing, diagnostic studies, but that we're looking now, especially this next year, to offering more advanced therapeutic care for sicker folks. Mm-hmm. And so the program's expanding. The hospital's taking a big first step, and they're making many investments to make this a high quality and safe program. So like you mentioned, I didn't interrupt, but like you mentioned, this region does have, is known to have high quality cardiovascular care. Mm-hmm. So the way I look at this is we're going to expand on that. Yes. And we're going to especially expand on that on the population that comes to AdventHealth for their care.
Well, and what you were saying there made me think of this. So maybe we start a little bit, can you give us the baseline of the level of cardiology care that is available right now with AdventHealth? Why, if my doctor says, I think we need to take a closer look at your heart, Victoria, I know I can stay right here in my network with the doctors I know and trust and count on you for that.
So most of what the care that patients will need, especially those with cardiovascular problems, can be taken care of in a hospital the size of AdventHealth. Of course, as you get into higher levels of care, sicker folks that need more technical expertise or resources that are beyond what a community hospital would have, then of course those patients go to hospitals that that can serve those patients, and we have great relationships with those hospitals and those physicians. But fortunately, we can take care of most patients. Mm-hmm. So within the outpatient setting, that means that if you're having problems, common cardiovascular problems, such as you're concerned with that you may be at risk for a heart attack or mm-hmm. in the future for a heart attack, or that you're having issues breathing and you're not sure if it has anything to do with your heart, or any rhythm issues with your heart, valvular issues with your heart. All those things we commonly see in the clinic. So we see a spectrum. So mm-hmm. we'll see patients that have minor problems with blood pressure or arrhythmias, if you will, which means the electrical part of the heart, to patients that actually have had complex surgeries, sick hearts. They may have had significant procedures in the past, and we are their primary caregivers. And I don't take that lightly, because patients actually make a choice to come here. And it's actually impressive because, again, they trust us. They may have complex histories, but they trust us to take care of them. So we can manage those patients. In the hospital setting, we can manage most patients that have the common ailments that we see, which are rhythm disorders, heart failure disorders, or patients that are concerned that they may be having a heart attack or whatnot. And we're evolving. We're going to be evolving this year to be able to manage those patients that do need therapeutics, mm-hmm. okay, and more advanced diagnostics, such as those patients that need a cardiac catheterization lab. We'll be able to take care of those patients at AdventHealth.
But on heart care, I'm looking for heart care, and I am trying to find a place that really aligns with the way I approach my own care. I know AdventHealth is that whole person resource when it comes to care, but then we also, it's not just, it's a full comprehensive program, and that word's big and it means a lot of things to a lot of people. But when we say comprehensive, we're talking about you can assess my heart health. You can determine what next steps I might need and provide many of them. And then there's also our amazing cardiac rehab we have. Mm-hmm. Can we talk a little bit about that and how that program brings it full circle, so that when you ask your patients, when you see them, how they're doing, they've got these great milestones they can check off?
Yeah, so patients, of course, foremost are looking for, hey, who can help me with this problem that I'm having? I think it may be my heart. Yeah. But then they really want to trust a place where they can sort of land it all. Hey, yes. I don't want to need to go somewhere else for 3 different things. I'm responsible for getting those records, and then I'm responsible for navigating all that. And it's very difficult for patients in this day and age. It's I feel almost a crisis for patients, because they are put in that position because healthcare is somewhat fragmented, mm-hmm. and so for a patient to feel like, wow, I've landed. This is my home. This is where I feel they're going to be able to take care of me. I'll commonly have patients that, yes, come to see me for cardiovascular problems and issues, but they may have a coexisting pulmonary issue or symptom or whatnot, and I can quickly connect them with who they need to be connected with. And AdventHealth really strives to make that connectivity work quickly for the patient. And that relieves so much stress, because patients feel like, oh my gosh, if I leave this room, then that's it. Right? Because mm-hmm. then how am I going to get back in? Because now who am I going to call? How's that going to work? And so having an organization and that's aligned with my values, which is, hey, there's more here than just the specific visit. You may be coming to see me for your high blood pressure or mm-hmm. because you're worried about a symptom, but there is much more around that. And that's what patients need. They need the help and the support and the system that's able to deliver, so that they can live better lives. And that's why they're coming to see us. So cardiology's, for me, I feel privileged, because it's sort of like you were mentioning at the beginning. It's something that when people think and they're worried about their heart, they really are worried because it's your heart. And so they really want to feel like they can get in, be seen, be taken care of.
Well, that raises something. You mentioned a word, fragmented. And knowing that our healthcare system, as you said, big picture healthcare system, has a lot of fragmented aspects to it. That's one of the things that has been at the forefront of our thoughts and processes as we're approaching our promise to help people feel whole. And it is leading to something super exciting. Let's talk about what's coming in 2026 that's going to help seal that ability to have all your care with one stop, not necessarily one stop there. Folks, there's going to be more than one appointment. Let's just face it, okay? But from the same core care team when it comes to our heart health. What's coming up?
Yeah. So before I get to that, so what you're speaking to is continuity of care.
Absolutely.
And it's that being able to take care and manage you and that patient. And again, we need to remember that patients have an emotional response when care is fragmented because it's hard. Why do I need to go somewhere else? I was here, I came here, I thought it'd be okay here. Who's going to take care of me? How is that going to be? What about my family? Are they going to be able to come? There's a lot of things that making it emotionally difficult.
Of course.
But there's also barriers that are created and risks that are created when healthcare is fragmented, and that's been documented in literature. And I use the example, had a patient recently that came to our hospital, and they were managed appropriately for their primary issue, which was an infection. But sadly, they had a cardiac complication and were starting to have symptoms that we were concerned might be an evolving heart attack. So they had to be transferred, and they got taken care of. They got good care, and the procedures that needed to be done were done. Patient did well, went home, but there was a mix-up in the medications. And so the patient was confused, was trying to get back to the person that did the procedure, that was difficult. Then our nurse, because it's our patient, calls the patient, hey, how are you? We're just calling about your appointment and whatnot. And he says, hey, I'm having problems with my medicines. And what we found out was he was missing a very important medicine that could have led to another heart attack if he was not taking that medicine, which he sadly wasn't. We got him on that medicine quickly. So again, that shows you that despite best efforts, okay, that things can fall through the cracks. So when that's under one umbrella, one system, that's under my eyeballs, it's under my nurse's eyeballs, it's under us, those things tend to less happen. They don't happen that often. So that's an example.
Up that relationship.
Yeah.
So you know each other, both the patient and the doctor know each other, the whole team.
Correct.
I love that.
And so going back to your question, hey, what are we looking
what's
forward
coming
to?
up?
So it's big news. It's big news.
What's the big news?
So the big news is that after 2 years of a lot of work by a lot of people, I'm probably just that big of a little piece of it, and there's other people doing big pieces. But after all those efforts, we're looking to the opening of a full service cardiac cath lab. And so what does that mean for the patient? So a cardiac cath lab is where if we're very worried about your heart and we think we need to do some investigating, looking inside of your heart, looking inside of your blood vessels, looking inside the heart itself, measuring pressures in your heart and whatnot, we can do that, okay?
How is that going to change the game for the people who are looking for that continued and continuity of care? What does that mean?
Well, so the first thing that strikes me, because I've only been here for 2 years at AdventHealth, the first thing that strikes me is as I was getting to know my patients coming to Advent, I'd ask them, so why do you come to Advent? Where were you before? And it's this is the only place I'll come. This is where I feel comfortable. This is where I feel listened to. This is where I feel like they're looking at me as a whole, like you had said. And so, and I was always struck by how committed patients were to be here. And I was also struck by the fact that many patients that come in with pretty concerning things where you might think they might say, hey, Advent's a smaller hospital, so maybe I'm going to go to a bigger hospital with my symptoms. No, they want to come to Advent. They come to Advent. So when it comes to cardiac patients, sadly, before the cath lab, okay, we've had to transfer some of these patients to other places when they're coming here. They've made the choice. We're coming here. And so, and then they have to get transferred. And that's we want what's best for patients, but that's hard for patients. And we, of course, want to be able to take care of our patients. So the cardiac cath lab is now going to offer us the opportunity to keep the patients here, okay, and not only be able to get a diagnosis, find out what's going on with the patient, but actually in a cardiac cath lab, you can start beginning to do therapeutics. So we can actually fix problems within the heart. And so this is the first step, and it's part of also a natural life cycle of an evolving cardiovascular program. Cardiology has been amazing in the last 25 years because, as a matter of fact, if you talk to a lot of the young training doctors, cardiology pretty much turned into a procedural subspecialty. So people go into cardiology, they want to be able to fix something, whether it's something within the electrical system, in the plumbing, which is what I tell my patients. I'm more of a plumber in the heart, or something structural with a heart valve or whatnot. So it's been a tremendous growth in the cath lab, and then what community hospitals have been able to do has also changed. So several years ago, actually, I was part of a study in Boston looking at the safety of doing advanced procedures at smaller hospitals, which eventually was shown to be a very safe thing to do, and is what we do now. But we didn't do all these procedures at a small hospital.
No, you didn't. You had to travel.
You had to, and so things have evolved because of technology, because of what we've learned about the body, because of medications. Things have evolved where we can safely do things now in hospitals like AdventHealth, and a lot is done at those hospitals. So that's great for patients. It's great for a community. It's always good for choice, so you have choice. So I'm excited for our patient community. I really am.
So I'm going to brag on you just a little bit here, because you came to us 2 years ago because we were very intentional about getting leading top cardiologists to help set up the program that's gotten us to this point. You said it's been 2 years of hard work. That's part of the reason why we invited you to be with us, because you've done this before and set up exceptional programs. You have a passion for making sure, like you said just a moment ago, you want to bring the advanced care to those community hospitals so people don't have to travel far from home. Tell us a little bit about the why behind you, what has led you to this point in your career. Why cardiology? Why this?
Well, the why in terms of how I have, I guess, been brought to the path that's brought me here. I'll say one word. It's my daughter, Ava. So
she's beautiful.
So we have a daughter that has a rare neuromuscular genetic disease, and because of her, we moved to Boston. And prior to that, I had been working in a big, busy, large group doing all kinds of procedures and whatnot. And at that time, my view of cardiology is very different than my view now. And my view was I favored larger hospitals for several things, and I was used to working in those hospitals. But part of my journey took me to a smaller hospital that was looking to look at the safety of doing advanced sort of cardiovascular care in a cath lab at smaller hospitals. And I was partnered with the Brigham in Boston, and we were part of a national study looking at safety, and spent years doing that. And that, without me planning, but that was what brought to me because of our journey with our journey with our daughter. That brought me to change my perspective, and as I did that for another hospital system, it began to change my comfort and maybe passion, because I started realizing the value of access. The value of access, and so I was fortunate to be able to work with a few hospitals to help them open their interventional programs. And so, and you learn from those experiences. And, coming, I guess I would call myself a little bit old school. You tend to be more critical, and because when I was trained, it wasn't uncommon that we would have more complications in the cath lab because everything was new. We were doing new things.
Sure.
So I sort of grew up in that era where we managed complications, and we sort of learned to feel a little comfortable doing that. And so I think that's a good perspective to bring in as you're opening a program. I think now that we don't have as many complications, doctors that are trained and don't see these things, and when when things happen, then they're a little bit unfamiliar. What is it? What do I do? This and that. So I'm glad we don't have those anymore. So I'm not saying that's good, but having had that experience also allows me to feel a little bit more comfortable as a leader to help the hospital.
It's a little more
with these programs.
comforting to know that as a leader that, you have been through those paces when it was, like it's an evolving technology and resources and understanding of the human heart. But to know that you've been there when things have gone a little awry, but been able to find a solution in the moment, that's very reassuring. At least my thought is I want someone who's faced a couple of those moments and gone, okay, and had good outcomes. I'm very grateful too that we have advanced to the place where we are, where it is those have been minimized. But it's nice to know that you're the guy we want.
But I guess where I would go with that is not just a personal part of my experience part, but it's more that the fact that the way we operate in the cath lab, and we have a great cardiovascular director who's actually with us right now.
She's right over there. Yeah, she's off camera, and she's going, don't turn those cameras on me. Who has
incredible experience. I think when you've been through that, the important thing is the way you operate and the way you prepare is you're preparing to avoid those. Since you've seen those before,
absolutely, right?
Then you're working to say, hey, we're not going to have those. So that's where it helps, because if you haven't seen it before, then it might be a little bit more difficult to say in advance prepare to avoid those things. So I'm lucky that I brought someone also that's been through that, seen that, and so that brings a sense of security and a sense of comfort to me that we're moving in the right direction.
Yes,
so.
We've absolutely set up an amazing team, like you said, with you, with Mandy, who's over there, and the director of our cardiology program, and the other physicians, the other physician assistants, the nurses, the entire team. This is, like you said, an entire team that is coming together for this. And they are the top of the fields. They're the people who've done this before and are excited to take it to the next level with our patients. What is the aspect from the doctor's mindset that you have that makes you most excited about being able to bring this level of care to the people who are choosing and saying, I want AdventHealth, and our community in general, but what excites you most about being so close and ready to do this for our community?
Well, I'll share with you a feeling.
I'd love to hear it.
Okay. So going back, when I was in training, I was more of a research cardiologist, so it was a little bit more cerebral. And I thought that that's where I was going to land. And then as I was doing my training, that's when we started developing some advanced therapeutics in the cath lab to take care of sick people. And I was always impressed with my mentors, faculty, those who were interventional cardiologists.
Yes.
They basically, when the sickest person came in, they could take care of them from soup to nuts. And basically all the other cardiologists, all the other physicians sort of went to them, hey, what do I do? And so I wondered, I wonder if that's something that would be, I could do, and something that I should do. Just because you want to do something doesn't mean you should do something. So you have to go through an experience to see how that fits, how that works. Are you doing well? Or do you feel like this is what you're meant to be doing? And, fortunately for me, at the end, I felt that that's what I was supposed to be doing. And so the same goes true with the environment that I work in, because I want the environment to come in, and I want to be able to take care of everything that you need. I mean, if I had a magic wand and have every patient come in, I'd be able to say, hey, I got you with the heart stuff. I got you from everything that you need. If I can't do it, this person's going to do it tomorrow. We got it for you. And I'd love to be able to do that. It's no different than taking care of people you love and care about. You want to be able to take care of, you don't partially take care of them, you completely take care of them.
Exactly. Right? And that's part of our promise, to take care of the whole person so they can feel whole. That's beautiful. I love that. And I'm glad you decided to move away from research and get into the clinical, the therapeutic side of this. I think, you're still involved. This is true. But let's think about one of the other aspects that we like to do on the Live Better, Feel Better podcast, and that is to let the folks get to know you a little bit more as that real person behind the lab coat. I remember when you first started 2 years ago, we were talking about things that you like to do, things that made you feel whole, and so on. So let's talk about it. Are you an athlete? Do you like to cook? What are some of the things that you do to keep your heart healthy by helping like reduce stress and keep you engaged and so on?
Okay. Can I tell you another story?
I love your stories. Of course
Okay.
you can.
So when my daughter Ava was little, she was very sick. She had a prognosis that was poor. She, wasn't supposed to do well we were told, hey, just be ready, right? And that was a difficult time because then we had two other little kids, and I was working as a young interventionalist, pretty busy. My wife was managing all that, and she was developing a non-for-profit to help families with what my daughter has. And so we didn't really have any help. So we didn't have really any just free time, anything like that. And then it'd be hard to find someone because you have a sick child and two other kids. I mean, that's hard. But we ended up finding someone, and we initially, said, "Oh, we'll go out to dinner. We're going to let's go at the dinner, have some wine, we can relax." We didn't feel good then afterwards. We didn't feel restored, and so we started thinking, and we said, "Hey, we need to actually do something that's going to restore our bodies and restore our minds a little bit, and we don't need, to go out to dinner just to go out to dinner. We need to do something restorative."
Interesting.
And so we started, participating pretty actively in a wellness fitness that was around a yoga practice studios, and eventually ourselves became instructors, not meaning
Really?
to, but we became instructors. But the reason I bring that up is because that started a realization that that for me to be prepared for the future and be the best that I could be for my family and for my patients, I needed to be the best that I could be. And so really was a realignment a realignment with what I should do with what I wasn't doing, meaning I had to evolve some new ways of living, new habits in my
Sure.
life. And so over time, that has, for me, been sort of the point where I start when I have a conversation with a patient, because when I have a conversation with a patient, they're coming to see me with a problem. Okay, we're going to take care of your problem. We are going to take care of your problem. Got that. Then what?
Exactly. That's a really important question.
Right? Then what?
Then what?
So the then what's super important, because the then what is when I turn it over to the patient. So we do our part, and then I say, hey, how did we get here?
Mm-hmm.
Let's say it's Mrs. Jones or Mrs. Smith. Miss Jones, Mrs. Smith, or Mr. Jones, Mr. Smith. How did we get here? What's your day like? What do you do? How do you live? How do you take care of these other things? What are the stresses in your life? All that thing.
Mm-hmm.
And then you need to start looking at what can we do better so that you can be a better person beyond what I do. Because the reality is that most of the ailments that affect patients when they need care, really at the end of the day, a lot of it is impacted. I mean, in some studies, up to 70% by lifestyle.
We hear it all the time.
Why do we talk about blue zones?
Right?
Like, hey, what's in blue zones? I want what they have, right?
Right.
So, but it's not, and then it's not only that. So then people go, okay, well, give me a list of the things that I need to do because you're telling me about, this, and that, and the other.
Got to eat
And
right.
so-
I've got to exercise and stuff. That's another list.
Yeah, it's
But
like,
you don't stop with the list.
no, it's not. So it's not about like a list. It's sort of about a pause, a reset. And what I tell people is, once we get them over things, is, hey, we're in a gratitude point. Okay, so this is a point where we can take a deep breath and just realize, I know we've been through all this, but then you're going to be better. Now we're at a point of gratitude. So if we have gratitude for that you're here, you're doing okay, you have people that you care about, what's that mean? And so how do you approach things when you approach things from gratitude? How do you approach food? If you approach it from gratitude, then what are you choosing to eat? Why are you choosing to eat when you're eating?
Mm-hmm. Mm-hmm.
And so if you have gratitude, then, and you're fortunate, and again, I live in a world where I see, and I'm close to a lot of children with rare diseases that weren't born with good lungs, good hearts, good legs. And so if you have good legs, and what's that mean for gratitude?
Right.
It means I walk more, I do more, right? So starting from that point of view, so that's where I start the conversation with them, and I really feel that my patient's going to do better. Not only, I don't want them to have a list, but I want them to be empowered, and I want them to empower themselves.
Well, because a list can get long, can get ignored, can get lost, but empowering a lifestyle impacting change or reset. You said pause. I love that word, pause. To see how they could live, what is possible now. I think there's such hope and optimism in that. I love the message behind that, and I've seen people who've been part of your care explain that very clearly. That it is, my life's different. I can do this now. I'm back to doing that now, and I think that's really important for what we're trying. All of us are trying to do, which is feel good about the life we're getting to live. Well, we're getting close here on time, and I don't want to miss the opportunity to see if there's anything I haven't brought up that we're talking about.
Well, you talked about Heart Month.
Yeah.
Right?
This is all leading into Heart Month.
So we didn't plan it this way. It looks like we planned it this way. Like, wow, the
Right,
cath
I
lab's
know.
opening like right near Heart Month, and like what. I'd like
It
to
just
say
came
I like to
together,
say
right?
we were that good.
Oh,
but-
yes.
but
For the record, we were that good. He's that good.
So it's interesting that the opening of the cath lab's coinciding with this celebration of Heart Month, and Heart Month might mean different things to different people because different people have gone through different experiences with their heart, and so to me, the way I would hope people will look at Heart Month is an opportunity to learn,
Yeah.
to ask questions, to appreciate sort of what is available for them to be better. Do I need to address something? Educate yourself. What is it that I need to know? I mean, I haven't had my cholesterol checked in a long time. Should I do that? Or, I never thought that, I'm getting older and I do have a family history. So I guess what I would say with regard to a message is that we overall, the medical community is very tuned in to cardiovascular risk and trying to mitigate that risk. And so we have guidelines, we have a lot of published data on what we should be doing. And things have changed a lot over the last 20 years where we have screening tools available.
Right.
So if you're wondering, oh my gosh, wait a second, think about this. My uncle, had heart trouble, and so did my dad. I've been getting older, and maybe you had a friend that you heard had something, and you're questioning, should I go maybe find out, how I'm doing? Yeah, go find out how you're doing. And as a matter of fact, I would say, I feel like and I don't know if this is because I'm just an N of one person, but my perception is that the community of physicians here is also engaged with that. And so
Absolutely.
I'm getting a lot more patients that are starting to ask those questions, come to see us for sort of this pre-screening sort of assessment of risk. And we have good tools now. And so it is an opportunity to do that. The second thing I would say is no matter where you are in terms of your health, whether you've had a cardiovascular problem or not, or whether you're healthy and want to see how can I be healthier, take it as an opportunity to really find out, hey, how can I be in the best shape from a cardiovascular standpoint that I can be? Because sometimes a lot of what we think we know or what we're doing, we think, hey, I'm doing the right thing. Like one example, I'll commonly get patients that will say, I'll ask them, so tell me how active you are and tell me what you're doing. And then they'll say, well, I mountain bike and, I'll get my heart rate up and do that. And I think that that's wonderful. But from my perspective, that's recreation. I tell them, hey, that's great, that's recreation. But I really want you to have a mindful focus on yourself, your breath, your body, know where you are, and then sort of explore where you can maybe be and go. And so, and I think that's important not only to maintain sort of a high level of health, but I also think that the way we approach our life and our wellness in our body mitigates against sort of those acute things that happen in life, like acutely a heart attack, acutely I fell and I broke my hip. Those acute things happen at times when our body isn't quite prepared.
Exactly.
And
maybe a balance issue and you fall and things like that.
Exactly.
Yeah.
And in cardiovascular events, we know that they happen when sort of the inside workings of our body, when our nervous system is up, our blood pressure is up, and it creates sort of a milieu, a mix, where then an abrupt thing happens, whether that's a stroke or that's a heart attack. It's hard to say that you can 100% mitigate against some of those things with just lifestyle or even the medications that we have, but I do believe that you can really lower that risk. And then if those things do happen, you're still starting off at a higher baseline. So I would ask people to celebrate one, our successes in cardiology, because it's been a tremendous field to be part of.
Yes.
It really has been. And then celebrate yourself. So celebrate that, celebrate yourself, ask yourself, hey, what can I do to be better? Or how can I help someone else? It could be your loved one. You might be worried about them. And choose this Heart Month to say, bring that awareness. And then spread that wellness sort of to other people.
It has been wonderful having you here. We're so excited that you were able to be part of the Live Better, Feel Better podcast. As we're talking about Heart Health Month and as we're talking about all the advances that are coming here, your passion for caring for our community is so evident. You and every member of our cardiology team, you practice what you preach in the sense of you have wanted people to know that you're here for them and you care for them. And I've seen it. I've heard the stories, and I can't wait to have more stories coming out as we get ready to open our cath lab and as you get to see more patients and have them understand just how important our heart is. There's a reason why we get to the heart of the matter, right?
Well, thank you. And I appreciate you inviting me to be on board. I only wish that I could bring the whole team here and you could see the whole group of people and the efforts that are going behind it, because it's truly a team. So
don't you worry. We're getting ready to tell that story in a lot of different ways.
Okay.
But maybe another podcast down the road.
Who knows?
That's what I kind of heard. I'm looking at my engineer over here, Hal. So
Part 2.
We'll mark him down for another one, okay?
Part 2
All
coming,
right,
yeah.
there we go.
Okay.
All right, thanks so
you,
much
Victoria.
for your time, and thank you for joining us for this latest edition and episode of Live Better, Feel Better. If you want to learn more about the cardiology program here at AdventHealth, the people here who are committed to caring for your heart, please visit adventhealthnc.com. And we'll see you next time for Live Better, Feel Better.